Hi, I'm Anoushka. I'm a Young Epilepsy rep, and I'm here today to talk with Bethan and Stacey about their roles and how transitioning works.
Hi, I'm Bethan. I'm a Roald Dahl specialist transition nurse and I coordinate care at Lewisham and Greenwich NHS Trust for young people with serious lifelong conditions who are moving from children's to adult services. Roald Dahl's marvellous children's charity, which provides specialist nurses and support to seriously ill children, established my post, and I'm the 7th Roald Dahl transition nurse across the UK.
Hello, I'm Stacey. I'm the Roald Dahl Epilepsy Nurse Specialist at the Queen Elizabeth in Woolwich, part of Lewisham and Greenwich NHS Trust.
Okay, so the first question is for Bethan, and it is, what is transition and how does a transition nurse help in this aspect?
Okay, so transition is moving from children's services to adult services. My role as a specialist transition nurse is to bring the children's services and adult services together to ensure that there's a smooth pathway for young people so that you get to meet the adult team and it's not a sudden rapid change, and to support young people through the process.
And for Stacey, how do you work alongside Bethan?
Hi Anoushka, so we work really closely together. In fact, we share an office. But since Bethan's come into post, we've been working kind of in the background really around transition. So we're looking at the pathways and the clinic structures that we need to make sure that we're not just rushing into transition and that it continues and it's an embedded part of our practice. We're having joint meetings with the adult epilepsy team within the trust that we work at so that we can have a shared vision and we can work together. So it's quite exciting at the moment.
And again, so what does transition mean to you, and how and when would that happen to someone around my age?
So what does transition mean to me? I think transition is something that we all go through as we go from a child to a young person to an adult. So transition is a concept that we all go through. The differences in healthcare, especially if you've got a long-term condition, is that means that different things. So if you're being brought to appointments by your parents, and mainly the clinicians are speaking to your parents, it's about us changing that narrative and that we're directing the care towards you and making sure that we're educating the young person and that we're empowering them so that they have all of the tools and everything they need to know so they can manage themselves. That's the concept.
Transition should be something that happens with you, not to you.
Yeah, 100%. And again, so for Bethan, if I'm nervous about transitioning, what could I do to potentially relieve some of this pressure and stress?
So firstly, to be nervous and anxious is a normal thing. It's a change that's going to happen to you, and it's normal to be nervous and anxious about it. The best thing to do, I would say, is to ask questions. If you're nervous about something, if you're unsure about something, ask questions. You have a team of professionals around you, whether they are from the children's service or the adult service. Ask questions. There's no such thing as a stupid question. You've also got your family around you. They're probably going through just as much anxiety as you. It's a really big deal for parents to let go and to allow you to become young, independent adults. But you also have other people who have been through the process already. So use your Young Epilepsy, use your channel network, and ask what other people's experiences were. What went well for them? What didn't go so well? And if there are things that didn't go well, raise them and find out how that's going to be different for you.
And for Stacey, what are some of the common things that you see young people with epilepsy getting worried about, and what advice would you give them?
Okay, so I think the things I see most commonly are the things that are portrayed in the media. So lots of young people worry and ask me questions about driving, about drinking alcohol and living independently. But I guess it's some of the things that aren't said that I pick up on the most. So I think they're worried about their confidence about speaking up in appointments. So it's really, really important that as a clinical team that we do start directing the questions to the young person as opposed to the parent, and empower them in that conversation during the consultation.
And for Bethan, how does the transition process actually work to involve young people? Because sometimes some of the language that adults can use can be quite difficult and confusing to understand.
Yeah. So we find in children's services, our clinicians are really good at speaking to your parents or your guardians, and they ask them all of the questions that are about you. So the biggest change is to try and get our paediatric clinicians to speak to you as a young person, and we need to empower you to know about your condition and how it impacts you and what we can do to support you. So to do that, we should start really early and use the structured approach. So the structured approach that we're going to try and use in my trust is the Ready, Steady, Go transition program, which consists of questionnaires that ask you as the young person to think about what you know about your condition and also what you need a bit of help with. So it might be, for example, you know what medications you're on, you know how much you take, and you know what time you take it, and that is really, really good. But when you run out, do you know how to get a repeat prescription? Or is this something that your parents do and suddenly you're going to go to university and not know how to collect your prescriptions? So it's looking at things that happen that we can support you with to make you more independent and empower you with the knowledge to become an independent young adult. So the sooner we start, the more time we've got to prepare you to transition to adult services. And the questionnaires that we follow, and I know many trusts have different versions, they're aimed for young people. So the adult language, we don't use it.
Okay, and finally for Stacey, what advice would you give a young person who is about to transition into adult services and doesn't have the support of a Roald Dahl specialist nurse?
Okay, so yeah, lots of young people sadly still don't have access to an epilepsy nurse specialist or a Roald Dahl epilepsy nurse specialist. So it's important to look to see what's out there. Thankfully, there are some amazing charities such as Young Epilepsy that have the channel and lots of fantastic online resources. So it's about looking what's out there and what's available to you. So speak to your clinical team that look after you to see if they can signpost you. And then I would say create your own resource pack. So everybody's epilepsy is so varied. So know about your own type of epilepsy and about you and how it impacts you, and make your own info pack. So, and we have to support workplaces and universities and other higher education organisations for them to know you and to be able to put the right support into you. So if you know yourself really well in your diagnosis and how an organisation can support you, then you can empower them to put those reasonable adjustments into place.
Anoushka, most schools will have epilepsy care plans for young people that are in school, which tells the teachers and the people that work in the school about you and about your condition. As you get older, you need to be that care plan. So the more you know about your condition, the more you can pass it on. And your care plan in school would be a really good way of finding out what other people want to know. So it'll tell them what to do if you have a seizure. If you're having the seizure, you probably don't know what's going on around you. But that's a really good bit of information to take with you to university as well, because universities don't really do care plan stays, I don't think, do they?
No, not necessarily, but yeah, there's lots of really good guidance out there in terms of what organisations need to do to support anybody with a long-term health condition. But each health condition is different, and epilepsy is so varied. So it is so important to know yourself and to have those conversations with those people that are supporting you, so that they can put whatever adjustments they need to into place.
That's quite reassuring to hear, and I'm sure a lot of other people would agree as well. So thank you both for answering all of my questions, and goodbye.
It was lovely to meet you. Goodbye.
Lovely to meet you, Anoushka. Goodbye and good luck in your future.
Thank you.